Today I'm going to talk about atrial fibrillation or AF, which is actually a disorder of the heart rhythm. As you know, there are two chambers of the heart. One is the upper chamber and the other, a pair of upper chambers and a pair of lower chambers. Now, there is a coordination between the upper and the lower chambers such that both of them beat at the same time, more or less the same time. But sometimes what happens that the upper chamber may turn rogue and start firing chaotically and rapidly. This is the condition which is called as atrial fibrillation, or simply as AF, which stands for atrial fibrillation. Now, this may cause someone to get short of breath, experience palpitation, dizziness, sometimes chest pain, and sometimes if it's too fast, someone may black out as well. Also, this disease can give rise to stroke, and this is perhaps the most important problem with this disease. Now, how do you treat this disease? Firstly, we have to control the rate of the heartbeat, or you can try to revert it back to normal. So the way you can do it is with drugs, and most of the time drugs are effective, but sometimes drugs are not, and then you may need some other procedures which is called RFA, or radio frequency ablation. This is done by passing catheters to the skin through your veins and then going into the heart and actually burn the circuit that is in the heart that is causing this sort of problem. However, there's another aspect of it which I have also mentioned. Apart from controlling the heart rate and the heart rhythm, we also know that we may have to thin the blood, because atrial fibrillation causes stasis of blood inside the upper chamber of the heart, which can give rise to blood clots within the heart, and this can cause stroke once these clots are thrown out. So it is important that in most cases, we need to thin the blood with blood thinners to reduce the chance of stroke. Not every patient with atrial fibrillation would need such blood thinner, but there is a way of scoring. We have a risk score assessment that we can do for each patient and find out what is their risk. If the risk is very low, then we may not have to thin their blood with anticoagulation, but if the risk is moderate or high, then we need to thin their bloods with blood thinner, and this is very important to prevent future risk of stroke. This is a fairly common heart rhythm disorder, but if taken due care of timely, then it seldom causes problem, but if it's neglected, that can cause stroke and other host of problems.